Ladies and gentlemen, I am going to tell you something about the deafness. It's a major disability. By WHO, World Health Organization has declared deafness as a major disability. I have done a lot of work on it in Pakistan. I went for this great problem, how to handle it and how to start initiating a war against deafness, how we can treat the deafness. I had the opportunity that I was sent by the E.N.T specialists both from civil sector and army sector to the President of Pakistan at that time, Ziaul Haq Sahab, and Chief Martial Administrator. I had a meeting with him there in Islamabad, and I told him that this is a big specialty, deafness. We should do something, and I am going to have this opportunity to tell you that if we have got the good diagnostic centers in the whole country like Lahore, Quetta, Peshawar, Karachi, then it will be a breakthrough. First there will be diagnosis, then there will be treatment of deafness. He agreed with my demand and he issued a directive to all provincial governors, oblique martial administrators of various provinces, and Federal Secretary Lieutenant General C.K. to establish the E.N.T center in Islamabad and also one center under the federal government at JPMC Karachi. This was the first breakthrough to treat this deafness. Before there was no proper system. Then I also requested him that we are organizing a first E.N.T conference in Lahore, and you come from Islamabad. It will be a big sport for this specialty to come up. Before it was dormant. There was no proper activity because there was no platform for the E.N.T surgeons. However, he was very kind. He accepted this request. He came from Islamabad, especially to Lahore airport. President Ziaul Haq Sahab, he came with all his companions, Federal Minister Health, Dr. Nasrullah Rana, Colonel Sadiq Salib, he was his press secretary. They came to the Lahore airport. From airport straight away to this Hilton Hotel at that time, which is now called as the O.R.L Hotel Lahore. He delivered a speech more than 1 hour. Actual time was 10 minutes. He was so happy. He said that I am feeling happy to talk on this issue. It was a hidden, problem. You have made it on the surface. Then he was so happy, he issued a directive to all the governors, Federal Secretary Health, what he could do positively. He said that you want anything? I said, no, I don't want anything. I want from all the 4 provinces. Now, mashallah, with the grace of Almighty Allah, you can see that this first E.N.T conference, you can see the photograph it. It took place with the passage of time. Then there was a 10th International E.N.T conference in PC Hotel Lahore. I was the organizing secretary of that. And Wasim Sajjad Saab, he was the chairman Senate, he was the chief guest there. Professor P.W. Alberti, he was the chairman of Department of E.N.T from Toronto University, Canada, and a world authority on the hearing problem, how to deal with the deafness. He came all the way from Canada. For 3 days, he stayed here in PC Hotel Lahore and gave the state-of-art lectures, how to treat the deafness problem, especially the younger children. He said that reduce the time of age from 2 years or 1 year to 6 months, or even as early as possible. Now there is a school of thought that hearing aid is the first starting point in the treatment of this deafness. Professor Alberti had a state-of-art lecture on the treatment of deafness in the older, treatment of deafness in the adults, in all the 3 age groups. He told in the various 3 lectures, because his specialty, which is called as this deafness, is a super specialty. He was the number 1 man in the world. We listened to him. With that, there was a big improvement in Pakistan. Also, to the treatment of deafness. Then in 2002, the third SAARC E.N.T conference I organized here in Lahore, Pakistan, with the help of God. The E.N.T specialist, he came from the SAARC countries and also from abroad. Professor John J. Wright, the world president, he came from Netherlands, and he did the state-of-art lecture, how to treat the deafness in the third world countries like Pakistan, India, Bangladesh, Sri Lanka, where the facilities or the financial status is not so good. We cannot afford the so many sophisticated technology. But just he again told that this hearing aid is the simple and easy way by which you can treat all the three age groups, in children, in adult, and in older age group. In older age groups, as you put the spectacles, except he said that except as you see this one hearing aid, just like this spectacle, as you put the spectacle on the eyes, you can put this hearing aid here. You will not become old. You feel old when you don't listen. When you start listening, you become young. I am telling you something about our conference in Orlando, in America, where I am standing with Professor Jennifer, who is the president of American Academy of O.R.L, H.N.S. She also was having this, you see, idea that hearing aid must be given as early as possible. Thank you very much.